Okay, so today we're diving into a really interesting one. It's a medication you've probably heard of, Pregabalin, or maybe you know it by its brand name, Lyrica. This drug, it's at a fascinating and honestly a critical crossroads in medicine. So, on one hand, it gets prescribed millions of times. It's this go-to solution for some really tough conditions like chronic pain and anxiety. But, and this is a big but, behind all that success, there's a story of some pretty significant risks, dependence, and some serious warnings. So, what's the real story with this two-sided pill? Let's get into it. All right, first things first, let's break down what this medication actually is. Because to really get a handle on its power, you got to understand where it comes from and how it's designed. So, Pregabalin is a synthetic drug. It's part of a family called the gabapentinoids. Now, what does that mean? Well, basically, they're designed to act like a natural chemical in your brain that, well, it helps calm things down, especially your nerve activity. You can kind of think of it as the stronger, more predictable big brother to another drug you might have heard of, gabapentin. And that extra strength, that potency, that's the key to everything, both the good and the bad. So you might be wondering, how does it actually do that? I mean, it's not like an opioid and it's not like your typical antidepressant. Its method is actually pretty unique, and it all boils down to one thing: calming down overactive nerves. Okay, check this out. Imagine your nervous system is like a stereo system, right? And for people with nerve pain or anxiety, that volume is just cranked way too high. It's blaring. Pregabalin doesn't just pull the plug and turn the whole thing off. No, it's smarter than that. It acts more like a sound engineer. It goes in, finds these specific calcium channels in your nerve cells, and basically blocks them. This stops the release of all those chemical messengers that are shouting the pain and anxiety signals. And the result? It's like someone's turning the volume knob down. The noise quiets down, and those overactive nerves finally get a chance to chill out. And this ability to calm nerves, well, it makes Pregabalin a super versatile tool in a doctor's toolkit. So let's take a look at who really benefits from having that volume turned down. First off, it's a huge deal for treating something called neuropathic pain. This isn't your regular headache. This is pain from nerve damage itself. Think of that awful burning feeling from diabetic neuropathy, or the pain that can stick around long after shingles. It's also used to help control certain types of seizures in people with epilepsy, usually as an add-on to other meds. And for generalized anxiety disorder, or GAD, it's a game changer for some because it works fast, sometimes bringing relief in just a week. And then there's fibromyalgia. It's one of the few drugs actually approved to manage that widespread chronic pain. But like we said right at the top, this is a two-sided pill. For all the good it can do, for all the suffering it can relieve, there's a very real, very significant flip side, and we absolutely have to talk about it. Yeah, the risks really exist on a spectrum. You've got the more common, often manageable stuff on one end. Things like drowsiness, dizziness, maybe some weight gain. Annoying for sure, but manageable. But on the other end of that spectrum, you've got the really serious, urgent stuff. We're talking about things like angioedema, which is this dangerous swelling in your throat, or even an increased risk of suicidal thoughts. And let's be clear, these aren't just uncomfortable side effects. These are flat-out medical emergencies. And it doesn't stop with just those immediate side effects. There's another risk, one that's a bit more insidious and can creep up with long-term use. And that is the potential for dependence and, well, misuse. So why is that? It's because of this. At high doses, Pregabalin can actually produce a high, a feeling of euphoria, relaxation, a bit of dissociation. And that effect is exactly what gives it its potential for abuse. People might start taking it not for their nerve pain, but just to chase that feeling. And look, this isn't just some theory. This potential for abuse is officially recognized. In the US, Pregabalin is classified as a Schedule V controlled substance. That's a legal designation that means, yes, the government acknowledges this drug has a potential for abuse, and that's why there are much stricter rules around how it's prescribed and dispensed. This brings us to a really crucial point. When your body gets used to having this drug around, you can't just stop taking it. Stopping suddenly can be incredibly rough. It can trigger a full-blown withdrawal syndrome. We're talking insomnia, headaches, nausea, terrible anxiety, even seizures in severe cases. This is exactly why you can never stop taking it abruptly. It absolutely has to be tapered off, slowly and carefully, under a doctor's supervision. Okay. But of all the risks we've talked about, there is one that stands out as the most immediately life-threatening. And it all comes down to what you might mix it with. Let me be crystal clear here, because this is no joke. Pregabalin slows down your central nervous system. You know what else does that? Alcohol, opioids, benzodiazepines like Xanax or Valium. When you combine them, their effects don't just add up, they multiply. This combination can slow your breathing down so much that it just stops. This can lead to a coma or even death. This is, without a doubt, the single most dangerous interaction you need to be aware of. So, wow. After looking at both sides of the coin, the incredible relief it can bring, and the very serious dangers, we're left with this question of balance. How do we weigh the good against the bad? All right, let's wrap this up with the key takeaways. Here's the bottom line. First, pregabalin is without a doubt a powerful and effective medicine for some really specific, tough conditions. Second, that power comes with very real risks, from side effects all the way to dependence and withdrawal. And third, because of all that, this drug demands respect. It absolutely requires careful medical supervision, and just as important, it requires you, the patient, to be fully educated on what you're taking and why. You know, when you really think about it, pregabalin is a perfect example of so much of modern medicine. It's a powerful tool, but it is not a simple fix. It's a trade-off. And that leaves us with the final most important question, which is one that can only be answered between you and your doctor. Is the benefit worth the risk for you? That right there, that is the crucial conversation to have.